And I'm trying to stay within the 15 minutes that you guys have given me, so I'm not looking at my watch, I'm just putting my timer on. So welcome very much. Let me check I've got it right. Natasha, Jodie, and Robin. Yep. Because I met you on Zoom, but it's always different in person. So thanks very much for coming along today. Just wanted to check that you're comfortable. So your chairs are comfortable?
Yep.
Okay, you can see the screens okay. I've set you up on 2 so we're not all crowded around 1. This is a great training space that you guys have got in your work area, so that's really good to come out to you. Not too hot, not too cold. Anybody thirsty and doesn't have water? I can see you're very prepared there, Natasha. Excellent. All right then. And importantly, the toilets, as you know, because you work here, are outside. So if you do need to go to the loo at any point, we can stop. So just let me know. Okay.
All right.
So as you know, the objective of today's training session, and again, thank you for your time on Zoom before our training session to ascertain our learning outcomes. Now, I know you guys have you've done first aid before and gone through the doctor's ABCD, but in order to get to the D, which is defibrillator, that we can concentrate on, I wanted to just go through doctor's ABCD and recap that again. So, can Natasha, D is for
Danger.
Yep. R is for
Response.
excellent. S is for send for
Send for
help. I put you on the spot. I
Oh,
put you on the spot.
sorry.
That's all good.
Send for help.
That's what happens. Send for help. That's it. Doctor's A. A is for
Airways.
airway. That's right. B is for
Breathing.
yep. And C is for CP. Yeah, that's right. Should I get you a coffee?
Yeah, probably.
CPR. And then
Yeah.
D is for defibrillation, and that's what we're here for. Is there anything you wanted to ask about any of those steps? So, doctors, D, obviously danger, make sure yourself or the casualty isn't in danger. Response, the cow's questions, can you hear me? Open your eyes, what's your name? Squeeze my hands. S, send for help, just to recap. That whole group mentality, we don't want to say, somebody call an ambulance. Call an ambulance, go and get me the first aid, go and get me the defib, which is what we're all about today. Send help. A, airway, check if there's anything in there, blocking it, tongue, vomit, seaweed if they've pulled them out of the river, or any other number of things can be blocking the airway. B, breathing, check with the back of your hand or by the rise and fall if they're breathing. I'm going through just as a recap because I know you've all done this before. CPR, how many compressions?
30.
Yep, how many rescue breaths?
2.
Excellent. And what do we sing while we're doing them? What kind of
Staying
pose?
Alive.
Staying
Oh, there's a
Alive
couple of
or
songs.
Baby Shark is
Baby
another
Shark.
one we can use these days. So, okay, so let's move on to defib. I'll sit down at this point. Now, if you can just refer to the information on your screen, I always find it's good to have this resource to follow because if at any time you want to recap after today, and sorry, I'm trying to have my back to you, but I want you all to have enough screen each. You can always go back to this site and I'll provide those links to you after today.
Cool.
So key facts. A defibrillator is a device that uses electricity to restart the heart or shock it back into a normal rhythm. So when your heart is in fibrillation, it's doing this. Okay, and we want to shock it back into a normal pump rhythm. So this is fibrillation. We want to shock it so that it's defibrillated. Okay. Now, where do you think that you might be able to find an AED, an automatic external defibrillator, in a public space? Anybody? Any ideas?
Hospitals, shopping centres, pools,
Where we work, absolutely. Where you guys work, yeah.
doctors.
Nathan up with the other ones.
Gold star. Airports, clubs, anywhere where people congregate, okay? Now, they can be used on people who need CPR, and they will determine for you if a shock needs to be delivered. This is something I really want you to take away from today, even if nothing, if this is the main thing that sticks, do you need to be trained to use an AED?
No.
Absolutely no, okay? So if you have an AED in your hands, and we will be using this one later, it will tell you what to do. Now, the casualty's chance of surviving using an AED is so much higher using the AED than compressions alone, so you cannot harm them. You will be told whether to administer a shock or not. The AED will walk you through every step of the process. Do not be afraid to use an AED because you could save somebody's life. Okay, so let's just go down a little bit.
As we said, a defib is a device that uses electricity to restart the heart or shock it back into a normal rhythm. They can be found anywhere where the public gather. When would I need to use a defib? After you've done doctor's ABC. So doctor's ABCD, D is for defibrillation. Now, each year more than 30,000 Australians experience cardiac arrest, and the chances, if this happens outside of a hospital, of them surviving is 1 in 10. If you use a defib, as I mentioned, those chances are a lot higher. Okay, so signs that somebody is having a cardiac arrest, which is different to a heart attack, both are emergencies, but a cardiac arrest is that heart stopping or going into fibrillation. Now, the signs of that are obviously collapse, loss of consciousness, abnormal breathing or no breathing at all, and no pulse. Okay, so we would have established that throughout the doctor's ABC process. So giving the person CPR and using the AED as soon as possible greatly increases the chances of survival. Using it quickly is absolutely crucial. Okay, now rather than me talk through, if you can just click onto the next tab for me please, Jody. I'm going to show you this little video with some very interesting acting. Feel free to giggle, most people do, showing how to use a defibrillator in this setting, in any emergency setting. Let me know, everybody can see the screen okay?
Yeah.
And the sound will be coming as well.
Save their life.
Alright, my bad. Let's start from the beginning.
When someone collapses, stops breathing and responding all of a sudden, would you know how to use a defibrillator to save their life? First, check for any danger. Check to see if they are responding. Squeeze shoulders and ask if they can.
I'm going to stop it at this point because we work in an aquatic environment. Can we use a defibrillator while they're in the water? No. So we need to make sure that the casualty is first taken out of the water. Okay, it's kind of obvious, but I'm going to point it out at this point. Here we go.
Right off.
Hear you. If there is no response, send for help. Call 000 immediately and find the nearest defibrillator. Check the airway by opening their mouth and remove any foreign material if present. Tilt the head back to open up the airways. Then check for breathing. Look, listen and feel for breath for approximately 10 seconds. If breathing isn't present, start CPR. Begin CPR to a rate of 30 compressions to 2 breaths. You must start CPR before applying a defibrillator. Open the defibrillator case and pull the handle to start the defib, or press the on button. The defibrillator will provide audio prompts on exactly what to do.
Begin by removing all clothing from the patient's chest.
If you're not able to perform breaths, you may continue with compressions only.
I'm just going to pause it there to say thank you very much, Jody. Just to say that obviously it needs to be a bare and dry chest. So if you've pulled somebody out of a pool, they might only have some swimmers on, and you might actually have to rip them off and grab a nearby towel or any piece of clothing. Really important that they're dry. I know that we're exposing them, we're no modesty here, but if you do have enough bodies around for a lifeguard maybe to be standing with a towel, especially in a really busy place, or at the end of the day, modesty versus staying alive, I know which one I'd choose, okay? So don't worry too much about that, but we do need to remove clothing. In the AEDs, a lot of the time, this is a trainer AED, but in a lot of the AEDs, you've got a razor. So that you can get rid of that hairy chest, if it's a man or a woman, I'm not judging, and get rid of that hair so that they can stick straight on, okay?
Yeah.
Cut clothing if needed.
There will be shears in the defibrillator case.
When the patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully at the pictures on the white adhesive pad. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture.
Wipe away any sweat. Their skin should be dry.
Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press the...
Now, I've never had to use a defibrillator myself, which I'm grateful for, but I do feel like I've shown people enough times that I'd be comfortable. So the thing that I always think is the seatbelt. So if you're in the driver's position, pulling the seatbelt over, where your seatbelt goes is where the pads go. Okay, so that's, if under pressure, that's a good thing to think, okay, I'm driving a car, these are where the pads go. Because I tell you what, me following those, you know, you really don't want to be trying to work out heads from tails in that situation. Thanks, Jodie.
Only to patient's bare skin.
The defibrillator will analyse the heart rhythm and assess whether a shock is needed.
No one should touch the patient.
It will only shock if there is a shockable rhythm. A defibrillator will not shock the person if a shock is not advised.
Press the flashing orange button now. Shock delivered. It is safe to touch the patient.
Continue CPR and only stop if they show signs of breathing or response. The defibrillator will analyse the heart rhythm again in another 2 minutes and may advise additional shocks.
It will guide you the whole way
Ambulance will be
through.
on its way. When they arrive, be prepared to let paramedics take over.
Okay, so as we said when we met, visual learning is often the best way, so I really wanted to show you something there. So we're actually in consultation. You've done enough CPR practical that you don't need to have a dummy or anything here today. But I did want to show you our training AED. I also wanted to warn you that it may only go to the pad stage because I'm not prepared to have a bare chest. Okay, so it may not go to the next stage, in which case I'll talk you through. All right, so has everybody seen either an AED or a training AED?
Yep.
Yep, excellent. Okay, so let's theoretically go through what would happen. We've done doctor's ABC. Somebody's brought a defib, casualty is on the floor, we've commenced CPR, and I'm going to pop it on now.
Training mode. Call for help. Remove pads from package in back of unit. Apply pads to patient's bare chest as shown. Apply pads to patient's bare chest as shown. Apply pads
Okay,
to...
so as I suspected, because I'm not bare, it's not going to go on, but that's fine. You heard it in the video. So it will now say, do not touch the patient, analysing. As it's analysing, this very clever machine will work out whether or not the patient lying down needs a shock or not. If they determine that the patient does need a shock, it will say shock advised, will again tell you do not touch the patient and press the red flashing shock button. So it can't be much clearer than that. It will then say shock delivered, it is now safe to touch the patient, recommence CPR. It will guide you through that 2 minutes of CPR and rescue breaths, and then the whole situation will start again. Okay, so does anybody have any questions about that?
Not really. I'm good.
You guys are good learners. No questions whatsoever. Robin, do you feel like you'd be comfortable if you're in a shopping centre and somebody collapsed in front of you to do the doctor's ABC and then up to the D, use a defibrillator?
Yeah, I think so.
Okay, excellent.
I've had a little experience, but not with that.
Okay, but you feel like if you
Yeah.
got to that, you'd be comfortable to add that onto your knowledge and use it in practice.
Easy.
Fantastic. Okay, Jodie?
I'm terrified.
Well, that's absolutely, it's all very well to do in
Yeah.
theory, but I think that's why it's really important to do this training on an annual basis, which
Yeah.
is what your workplace, obviously being an aquatic facility, needs, requires. So I can say from experience that over years and years, now I've probably been doing this every year for 15 years now, and I do feel confident, fingers crossed it doesn't happen, but I do feel confident that if I was put in that situation, knowledge would take over rather than adrenaline shutting me down.
Yeah.
So it's just that repetition. So
Yep.
that's absolutely a valid way to feel, but yeah, definitely ongoing training is the
Yep.
solution to that. Natasha?
Yeah, I feel good. But yeah, again, it's scary to think that you might have to do it. So,
Exactly.
Yeah.
Exactly. And you know, that comes down to, I think we always talk in our courses as well about debrief. If something like this was to happen, that debrief, and all of you guys manage staff here, I understand. So it would be really important to have that debrief to make sure that your staff are okay. So I think we're just about ready to let you go. I know you're really busy people. Do you feel like the learning outcomes of being comfortable with a defibrillator and recapping Doctors A, B, C, D have been met?
Yeah.
Excellent. And I'll provide you with these resources so you can recap
Yep.
in your own
That'd be
time
good.
as well.
Mhm.
And just want to thank you very much for being here.
Thank you.
Thank you.